that's where the hormone that makes you hungry called ghrelin is created. And when the stomach is cut and when the vagus nerve to the stomach is cut, serum measured blood ghrelin levels go down. When ghrelin goes down, you're less hungry. In other words, up, high ghrelin, hungry. Low ghrelin, not hungry. And when we cut through the stomach with the mini-gastric bypass, that hunger goes down. And in fact, we go out of our way while we're there to cut this special nerve called the vagus nerve, because in studies in animals, it decreases ghrelin. And for years, I've been doing this for over 20 years, not the mini-gastric bypass, but the other kinds of weight loss surgery. There was a gentleman, a surgeon from New York, who did studies in his patients where he just cut the vagus nerve for patients with ulcer disease. And he didn't know about ghrelin then. It wasn't invented or wasn't found then. But he found that they got weight loss with that vagus nerve being cut. So we do that, and that's part of the reason we think why the surgery is successful. It makes a smaller stomach, it bypasses some intestine, and then it drops the ghrelin. And those are the three components, 2 physical and 1 hormonal change that make things better. One of the other things I was going to ask you about is you were a pretty bad diabetic before the surgery.
Yes. I was taking 175 units of insulin per day, plus pills, glucopods, and Actos. Now I still take the glucopods and I still take the Actos, but I'm down to 5 units every night of Lantus.
Great.
And then I'm maintaining an A1C of 5.5 to 6. And my blood sugar, I took it last night, is 119, which is still a little bit high, but I take my Lantus and it controls it.
And just translating, you are very knowledgeable about your disease, but for those who are listening, if you don't know this, the demonstration here is we've got a lot of weight loss, but we didn't cure his diabetes. You have to be careful. Sometimes I get over enthusiastic and say we cure all diabetes. I hope I don't say that too often because it's not right. But we cure lots of diabetes, and for those people who don't cure, like in your case, I think we made your diabetes quite a bit better.
Oh man, a lot better.
Right.
I was taking 4 or 5 shots a day. Now I only take 1.
And you talked about that hemoglobin A1C, and basically that's a measure of sugar-coated hemoglobin. So if you dip your hemoglobin in sugar long enough, it starts to stick sugar molecules on top of it. And there's a direct relation between how high your sugar-coated hemoglobin is in your blood and death and heart attack and blindness from diabetes and amputation and kidney failure. And so if you drop that to the normal range, that 4, 5, 6 range, you can take a patient's risk of heart attack and stroke from diabetes and blindness and amputation and kidney failure and drop them back towards normal. And so it's really exciting to hear about that improving, and it's kind of one of the real rewards that we get from doing the surgery. We see people where we really think, you know, over the next 4, 5, 6, 7, 8, 9, 10 years, we have a chance of maybe protecting you from some of the complications of diabetes. And
I have a feeling that I probably wouldn't be here if I hadn't have had the gastric bypass. And I think it's given me an extra 10 or 15 years. I'm 68 years old. Add another 10 or 15 years, and I think I'll be done with life.
that's about when the warranty runs out, isn't it?
Yeah.
Get up there to when the odometer gets to 100, it's about time, right?
That's right.
Now, do you remember the surgery itself?
Oh, I remember a little bit about it.
Was it a big deal? Was it, you know, how long were you in the hospital?
It wasn't a big deal. I was ready to go home that afternoon.
Yeah. Yeah.
But you weren't ready to let me go home.
Well, I'm that way, so I apologize. But that's one of the other neat things about the surgery. You know, this is really big surgery, really potentially dangerous surgery. And what we've done, I think, by doing lots of cases and the technical things that we do, we've taken a fairly risky, fairly dangerous surgery, and we've simplified it and decreased the risk. So we can take people who have severe diabetes and lung disease and things like that. You may remember we met that one lady yesterday we kept for 2 days. Mm-hmm. She had fairly severe low oxygen lung disease, and we kept her for an extra day, but she's done great. She got through the surgery safely. And so we're really proud of the fact that we've taken an important therapy that we think a lot of people can use